Hello, everyone. This is Dr. Villa again. I have a special what do you call this? This is a special episode because uh, instead of me discussing certain things, I'm actually going to do like a little video reaction on Dr. Makis' position on Scott Adams' turbo cancer or disseminated prostate cancer. And I'd like to react or add to whatever Dr. Makis has already stated. And so, yeah, here it is.
The problem is that Scott Adams's immune system is damaged. And so if you give him Anktiva infusion, you're just trying to replicate his immune cells that are damaged or non-functional. So that is a non-starter. So you're combining Pluvicto, which is a mild targeted radiation treatment, with an immune infusion that has no chance of working. This is medical malpractice. And I said this 2 months ago. Now, the thing is that what Scott needs is an attack on his cancer to try to stop this rapidly progressive cancer. And one way to do that is to give him ivermectin, mebendazole in high doses and combine it with chemo, or you can combine it with Pluvicto or both. And that way you're getting the chemosensitization properties of ivermectin and mebendazole to enhance the effects of chemo cancer cell killing. And you're getting the sensitization properties of ivermectin and mebendazole to enhance the radiation cancer cell killing by Pluvicto. So you're effectively enhancing the effect of these cancer treatments to attack the rapidly progressive cancer cells that Scott is dealing with right now.
The video of Dr. Makis I actually watch it in Substack. Okay, I don't think it is available on Facebook, but basically, the what he has discussed is about the disseminated or stage 4 cancer of Scott Adams, and everybody knows who he is. He's a uh, he's a famous person. As far as I can remember, he's a cartoonist, and so he actually declared it like last May. Yeah, I think May of 2025, that his cancer has progressed to stage 4, which means it has disseminated all over. He has multiple metastatic lesion all over on his bone. So it's a bone metastasis. So what Dr. Makis was saying um, is that they are using the wrong agents to treat him, and it's also out in the, we'll call this, in social media. I don't know if it's on X. And again, he mentioned it on Substack. There were like 2 medication or chemotherapeutic agent. No, it's not really it's not the usual chemotherapeutic agent that they're using on him, and he's what do you call this, in admitted at Kaiser Permanente. Okay, and so basically the 2 medication, or at least the first medication that was used in him was Pluvicto. I will direct you to listen to what Dr. Makis was saying about this agent, because he's very, very familiar with it. I'm not going to expand on it anymore. But, and the other one is the agent that is actually being promoted by Dr. Sun Xiong. Dr. Sun Xiong is another uh, what do you call it? Supposedly, he's actually a surgeon. He's a billionaire, but he's also into a pharmaceutical development, and he has this agent called, I believe, is Activa or how. I may not be saying it um, appropriately or properly, but it's an agent that is supposed to boost the NK cell, so that you can kill the cancer. So these are the things that they are planning to give, or they've already given to Scott Adams. And now the latest development is that he's already paralyzed. That's from his description. And it's very difficult for him to really get any of the doctors to talk to him. So basically, what they're doing to him is palliative. So basically, when you say palliative, that's the end of it. The cancer is incurable, and it's either they're just making him, you know, uh, uh, what do you call this, comfortable, or there's really palliative means no cure. Okay, so there are a few things, or the most important thing that Dr. Makis actually discussed in his video was the use of the repurposed drug, namely ivermectin and fenbendazole or mebendazole, whichever one he mentioned. And we're not 100% sure if Scott Adams actually tried this agent already, but I just want to add something because I have my own fair share of treating, cancer patients. I'm not an oncologist. I'm a pulmonologist, intensivist, and functional medicine by craft. But by default, all these patients, a lot of these patients, not all, a lot of these patients are actually coming to me just because I've been treating a lot of post-COVID cases and post-vaccine complication or long vaccine. And I've been very vocal about this, that the COVID injection is actually, there's a big correlation between the development of, if it's not causation, but we have enough reason to believe now that it's actually causing turbo cancer. That's the layman's term that we use when somebody present with a what do you call this, progressive cancer. Okay, because they present very big and they're widely metastasized. So I'm getting this kind of patient. And what are the kind of patients that I get? Like quite a lot, from breast cancer to melanoma to pancreatic cancer to lung cancer, obviously, because I'm a pulmonologist. And what else? Prostate cancer. Believe it or not, I have quite a few of prostate cancer. So, as you, I will just mention this, that it was September, back in September this year, there was a orthomolecular publication, which is about the non-chemotherapy treatment of cancer. Actually, the use of repurposed drug was included in that protocol. So if you guys want to check it out, or probably I'll post it here later. It's the old orthomolecular publication back in September 2025 or 2024. No, it was this year that it was publicized. And it's about the, as I said, non-chemo treatment of cancer. Okay. So, what I wanted to say, I agree with Dr. Mack is completely in terms of the use of non-repurpose or repurpose medication or drugs, specifically the ivermectin and mebendazole. And obviously, the mebendazole is being widely used by a lot of people, even though it's not approved for human use. But molecularly or biochemically, it's very similar to mebendazole. I usually use a combination of ivermectin and mebendazole. And this repurpose agents, what is very important to emphasize, and Dr. Makis already said this in his video, is that it makes the cancer more sensitive to whatever chemotherapeutic agent. And at this point, at this juncture, I want to tell you that I'm not completely opposed to using the chemotherapy, but the problem a lot of times is the people using the chemotherapy, they don't know when to stop, because it's getting to the point that the immune system is getting killed, and the chemotherapy doesn't address the stem cell of the cancer. So the highly or the actively dividing cancer are very susceptible to the chemotherapy, because they are highly dividing and they are like crazy, and a highly dividing cell is always what do you call it, likely to be responsive or be killed by the chemotherapy. But one thing that the chemotherapy doesn't address is actually the presence of cancer stem cell. And so when the cancer dies off, the tumor, after chemotherapy, it dies. It goes away. However, the cancer are still around. So, and the immune system is also dead. So when the chemotherapy is gone, the cancer cells, stem cells, regroup and form the cancer again. And so it comes back with a vengeance. And I think that is what's happening to you. Anyways. And then um, when it comes back, there's no more immune system to take care of it. The immune system was actually completely killed by or wiped out by the chemotherapy. So the other thing that I want to add in the treatment of cancer with repurposed drug, and also based on that publication, the orthomolecular publication, is the use of high dose IV vitamin C. And that's what I use. Obviously, I don't have hundreds and hundreds of patients, because I just started treating cancer. I would say, well, in the last couple of years, or 3 years, I actually started treating, but they didn't come to me like all together, or not too many in the beginning. But now I'm actually getting more and more people coming in to be treated. So to me, it's very important to include the IV vitamin C for a few reasons. Nick Halsher has a very good article of the IV vitamin C, the use of IV vitamin C for a lot of diseases, and it's in Substack. So I would recommend that you guys look for the article of Nick Halsher. And actually, I restack it, so you can come to my also my page or my account, and I restack it or reposted it. The importance of IV vitamin C is it's not only addressing also the what do you call this, the stem cell of the cancer, because it kills the stem cell of the cancer, but the vitamin C is a very powerful antioxidant, is a very powerful anti-inflammatory, and it's good for healing. It's very, very good for healing. And so it's a very versatile molecule, is a very versatile substance. It's a very versatile micronutrient. No? And so even the effect or side effects of the chemotherapy, and even the side effects when the cancer cells are dying, the vitamin C is very good in alleviating that. And so I think if Scott um, uh, Taylor Adams um, will use uh, the what do you call is the antiparasitic or repurposed medication. I think it should be um, used together with the high dose IV vitamin C. And usually, depending on how bad the cancer is, in his case, it's a widely metastasized cancer, prostate cancer. Um, the dose that we use is between 1 to 1.5 grams per kilograms. That's very high, but I've used it in patient and they're doing well. And obviously, I am using it for other condition. And the other thing that I would like also to emphasize is that I don't know the vaccination status of this person. I don't know the the COVID status. Was he infected before? Was he vaccinated before? I mean, I'm assuming that he is vaccinated because he's in the he's in that group that would take that vaccine anytime. And so if he's vaccinated or had COVID infection in the past, it is very important to address that status, to address that condition. And why? Why is it very important? Because I've been very vocal about this. The preliminary findings in our study is that there is a big and massive immune dysregulation when you get infected or you have the vaccine. So why is it very important? The immune dysregulation itself is one of the mechanisms why you develop cancer in COVID, right? Immune dysregulation, which includes autoimmune, it includes immune deficiency. And I won't be surprised if he has a severe immune deficiency. How are you going to fight the cancer when you have severe immune deficiency? So one of the things that I do before I even really go into the treatment of this cancer, turbo cancer, okay, is to address the status of the patient, vaccination and previous history of COVID infection. I am already to the point that all of these patients who got infected, got vaccinated, or both are going to have the immune dysregulation. And to emphasize, the immune deficiency. These people are developing immune deficiency that includes the deficiency of the CD3, which include the CD3 is the entire population of the CD4 and CD8. But from my observation, the CD8 is more affected by both the vaccine and the infection. When you don't have CD8, you won't be able to fight cancer. You know, so, and the other one is you have another immune deficiency, which is the IgG deficiency. That's our main natural antibody. IgG deficiency will make your cancer worse. It's like not having ammunition when you're in a war. You don't have ammunition. And so when the patient has immune deficiency, we call it IgG immune deficiency, common variable immune deficiency. I replace it even if the patient has advanced cancer. I replace it. I replace the antibody because it will help fight the cancer, help also fight the what do you call this? The infection that these patients are growing. When they have immune dysregulation, this cancer patient, what they have is the reactivation of all the latent viruses. Number one is Epstein virus, the herpes simplex 1 and 2, CMV. You have the shingles, and then you have the herpes virus 6. And guess what? All these herpes viruses that are getting reactivated, they will make the cancer grow even more. And so you see, You have autoimmune. You have to treat that when they have cancer. To me, when I see autoimmune already, that is the 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 red flag that that patient is very high risk to develop cancer. So these are the things. The immune dysregulation, the immune deficiency, which is T cell and B cell deficiency, and then the reactivation of all these other viruses that contribute to more immune deficiency, more immune suppression, and also all these viruses make the cancer, the pre-existing cancer, much worse. So you see, it is very important. I don't know if this person, Scott Adams, was what do you call this, assess for the effect of the vaccine and for the effect of the previous infection, you know. So that's I would like to emphasize. And so the doctors, the doctors, I'm going to tell you now, if he is going to go into the use of the repurposed drugs and into the use of high dose vitamin C and into assessing his COVID and COVID infection and injection, it better be a person or a doctor who has experience like that. I'm not trying to promote myself, but I'm willing to help anybody who's needing help, especially in this case. This is going to be a very interesting and a very challenging, case to treat. But everybody should be willing to cooperate, because this is not a very straightforward case, obviously. This is not something that does not have any other medical complication. He has a lot. He has a lot on his plate. He has a lot. It's overflowing. And so, well, I hope I said enough, but I'm getting so excited about this because, I see this every day. I told you, I'm not an oncologist, but I'm getting all this cancer patient as a last resort of the treatment for the treatment of their cancer. And the more chemotherapy you use, the faster these people die. Unless, you have to support them. You cannot just be giving something that will kill everything and anything on its path, except the cancer stem cell. That's why it comes back. So, and you have to support the patient nutritionally. IV vitamin C. I use other stuff, but I cannot discuss it here. I'm just getting so excited about this because, especially Dr. Makis mentioned about starting a something here in Florida. I'm with him. We talked about it, not to the extent or not in detail, but I've been practicing here in Florida for what, more than 20 years. And well, I kind of know what I'm talking about. So I hope he made it here. I'm gonna be collaborating with him. We don't have a proper or formal discussion yet, but I can contribute, or I have cases. Probably I'll start publishing all the cases that I've treated when it comes to cancer. But it's interesting. Obviously, uh, not everybody is a success story, because when they come in, they are hanging by a thread. And so when you get this cancer patient like early enough, just like anything else, even if, like, let's say you don't cure the cancer completely, but you're going to improve the quality of their life. And I can say at this point, based on the number of cases that I've treated, that you can definitely prolong the life of this patient with quality. I have that in my heart. So yeah, I just want to say that. And lastly, um Scott Adams, I know what these people are going to recommend to him. um, they're in the mainstream medicine because there's really nothing that they can uh, give him. Um, what do you call this? Based on what he's saying, they even, I think, stopped giving the the two agents or one of the agents because of the sign and symptom and because of the complication that he is experiencing right now. They're going, I think it's the agent of Dr. Sun Xiong. um, uh, what do you call this? Dr. Makis made a comment that this agent is not going to work because you are just going to be supposedly boosting the NK cells that are already defective. And I agree to that. And to add some more, another layer on that, that's why it's very important to address the COVID injection and infection status of the patient. Because if you have so much of the spike protein, you have so much antigen in the body of this cancer patient, there is no way that uh, this this agent is going to work. Why? Because when the patient was injected or even infected, the very NK cell, CD8 cells that are supposed to be getting boosted by Dr. Son Xiong agent, they are defective. I agree to that because it, they are transfected, they are infiltrated by the spike protein. And the spike protein, we are already implicating very strongly that it is causing cancer. Remember, the spike protein is also capable of suppressing your p53 gene, is capable of suppressing the BRCA gene. So you can have cancer just on the spike protein alone. So you cannot boost or make this cell replicate that are already so defective with so many mechanism. And from my standpoint, the presence of the spike protein itself in these cells um, is enough for the cancer to grow like crazy or not to respond to any agent that that you're going to give to that sick patient. And so, if Scott Adams has not, ventured on using the repurposed drug in this non-chemotherapy, protocols that we are using, he needs to work with somebody like Dr. Makis, and I don't know, there are other people probably who are not as famous as him who are also, familiar with the protocol. He should work with those kind of doctors. And yeah, that's very important to emphasize. I've been itching to make a comment on Dr. Sun Xiong agent, what it can do from the perspective of the COVID injection and COVID infection. But, you know, uh, during the time that he was actually interviewed by Tucker Carlson, that was the time that I was like, I've been thinking about it, what can I say? And I don't just buy the idea that it is the solution to this kind of cancer. Okay, so what do I have? Lastly, I think what they are going to suggest to Scott Adams is for him to have, it's going to be sad, a physician assisted suicide. I think that's going to be the last one because there's nothing else that they can give him. And yeah, that's also an option. And it's actually, more and more people are doing that just because, um, out of hopelessness and desperation. Yeah. Okay, so Dr. Makis, William, Dr. Makis, just in case uh, you happen to listen to my video, I would love to see you here in Florida, and I would love to work with you. You know how I work here. Um, Dr. Makis came to my center last September during the event that we had with World Council for Health, the Healing Beyond COVID. Okay, I mean, that is my take on this. And I think there are a lot more to say, but I'm just saying whatever is in my mind right now. Okay, and to everybody who's suffering from cancer right now, I seriously advise to you guys to get, other, or to consider other option. I'm not stopping you from getting the chemotherapy, but that um approach of chemo, which is poisoning, and burning, which is the radiation therapy, and cutting. So you cut, you burn, and you poison. That's really the treatment of chemotherapy of cancer nowadays. And it's been going on for how long? It's been 50 years, and they have not come up with the cure. And so forget about it. They will not let it go. It's a lot of money to let go. So cancer patient, just have an open mind, and you know, look at your option. There's no harm in trying. Okay, no harm in trying. And I wish everybody um, recovery, if it's at all possible, or at least stabilize whatever condition you have. And for Scott Adams, I'll pray for you, and I hope you try, seriously what we're talking about. Okay, this is it for today, and then goodbye. Thank you so much. Bye.